You might think cystitis is just a common inflammation of the bladder during cold weather, but why doesn't it go away for years? You've already tried every possible treatment, including antibiotics, but the moment you get cold, cystitis comes right back. Why? Did you know that 80% of women treated for cystitis don't actually have it? Then what do they have? Maybe you can't cure cystitis because it's not really cystitis. Or maybe it is, but you're doing something wrong. What exactly? We'll explain that and also reveal cystitis treatments you can use at home. Today, you will learn: why don't antibiotics help with cystitis? What 2 mistakes are you making when treating cystitis yourself? How can you train your body to stop having seasonal cystitis in the cold? Who should you trust, a urologist or a gynecologist, if your cystitis won't go away? What does an old urologist recommend to get rid of cystitis for good? What do a runny nose and cystitis have in common? What's better to warm up with cystitis, your feet or your stomach? How does a Chinese grandmother treat cystitis? And do you really need diuretics for cystitis? But first, think about it. How often has cystitis crossed days off your calendar? Every winter? Every 6 months? Or even more often? If cystitis occurs more than twice in 6 months, doctors already classify it as chronic. But here's what's surprising. Some doctors believe chronic cystitis doesn't even exist. If a condition doesn't go away for years, maybe you're treating the wrong thing. Your doctor might not be able to distinguish cystitis from pelvic inflammation, for example. Today, our channel's expert will explain how to make sure your doctor hasn't missed another condition. Don't miss the advice from an experienced urologist.
And now, information that can save you from taking antibiotics unnecessarily. It's well known that antibiotics are always prescribed for cystitis to kill bacteria. But sometimes, tests show bacteria, and yet you don't actually have cystitis. This often happens in older women and is called asymptomatic bacteria. Asymptomatic means the woman has no symptoms, no frequent urges, no pain, no burning sensation during urination, none of that. But urine tests show an extreme amount of bacteria. These bacteria might trigger cystitis in the body, or they might remain without causing any symptoms, coexisting with you without problems. That's why, in the absence of clear signs of illness, an experienced doctor takes a wait-and-see approach and does not immediately prescribe antibiotics, but observes the patient for a while. In this case, it's best to be examined not only by a urologist, but also by a gynecologist. Urologists focus on urinary tract infections, while gynecologists take into account hormonal changes and the health of the female reproductive system and pelvic floor. Asymptomatic bacterial overgrowth may be related to changes in the vaginal microbiota or hormonal imbalances after menopause. In elderly women, other conditions like symphysitis or pubic joint arthrosis can resemble cystitis. The problem is in the bones, not the bladder. And of course, antibiotics won't help in such cases. There are also other issues that inexperienced doctors might mistake for cystitis, especially in older patients. Misdiagnosis often occurs when lab tests seem normal, the bladder looks fine on ultrasound, but the symptoms point to cystitis, and the doctor makes an incorrect diagnosis based only on those signs. Sometimes doctors simply say that frequent urination and chronic cystitis are just age-related changes, but that's wrong. Cystitis has nothing to do with age. It's not an age-related condition, and it's not normal for elderly women, just like urinary incontinence isn't. Although with age, cystitis may indeed become more frequent in women. Why does that happen? Our expert will explain. He is an experienced urologist, Marat Shayaipov.
In elderly or postmenopausal women, cystitis is much more common. This is due to the decrease in female sex hormones, which leads to thinning of the bladder mucosa, making it easier for bacteria to adhere and penetrate its wall. This then leads to inflammation. That's why we, as urologists, always refer such patients to gynecologists who can adjust their hormonal status.
It's not just women. Men can get cystitis too. About 20% of men experience it at least once in their lives. In men, the condition is usually linked to prostatitis. But in both men and women, cystitis is an inflammation of the bladder. Let's pause for a moment and understand that inflammation is a defense mechanism that helps our body fight infection. It's part of our immune response, the body's reaction. If we injure ourselves, inflammation in the wound helps eliminate bacteria. If we catch a cold, inflammation in the nose signals that the body needs to get rid of the virus. That's why we sneeze. In the case of cystitis, when bacteria enter the bladder, the body also triggers inflammation. You start going to the bathroom more often to flush out the bladder and remove unwanted microorganisms. Frequent urination in cystitis is like sneezing with a runny nose.
So, should you take diuretics when you have cystitis? Normally, urinating up to 8 times a day is standard. The urge to urinate arises when about 1 glass or a little more of fluid collects in the bladder. But if needed, a person can hold it and accumulate up to half a liter. Normal urination helps flush out microbes from the bladder, which is why it's so important not to hold in urine. Going to the bathroom every 2 to 3 hours is perfectly fine. During cystitis, the urge may come every 15 to 20 minutes, and that's also normal. It's the body trying to wash out the bacteria. You can help your body with something as familiar as parsley. Parsley has a mild diuretic effect and helps flush bacteria from the urinary tract. You can simply eat more parsley during cystitis, but it's even better to crush the greens and extract the juice. Then mix it with lemon juice in a 1-to-1 ratio and take 1 tablespoon 3 times a day after meals. You can also use ready-made herbal mixes from the pharmacy to treat cystitis. We recommend pouring boiling water over them and letting them steep for 15 minutes. It's best to drink this on an empty stomach. I'll tell you more about other treatment options for cystitis at the end of the video. You'll learn about the 3 most effective remedies. But for now, let's return to the main medical recommendation for cystitis. Drink more water. It is believed that drinking plenty of fluids helps flush out bacteria from the urinary tract. That's why it's important to drink at least 2 liters of fluid per day to stimulate frequent urination and facilitate the elimination of bacteria. Remember, you must not put yourself on a no-water diet just because it hurts to go to the bathroom and there's burning and stinging. That will only harm you and help the bacteria. When you're sick, water becomes your medicine. This, by the way, applies not only to cystitis, but to other viral or bacterial infections as well. No wonder doctors recommend drinking more during the flu or a cold. For example, in case of a runny nose, having enough water in your body helps to thin the mucus, making it easier to expel. Speaking of runny noses, what do you think cystitis and a runny nose have in common? Besides inflammation. It turns out that some medications we use to treat a runny nose, such as antihistamines, which reduce allergy symptoms and swelling, can cause dryness of the mucous membranes, and not just in the nose, but also in the urogenital tract, increasing the risk of cystitis. In addition to dry or damaged mucous membranes, hypothermia also raises the risk of developing cystitis. Many believe cystitis is a disease of short skirts and cold weather, that cystitis only comes from being cold. But why then do women who bundle up warmly in winter still get it? Let's ask an expert. Indeed, acute cystitis or a flare-up of chronic cystitis most often occurs due to hypothermia because immunity decreases and the bacteria already present in the organ begin to multiply actively. But in addition to this, stress or even intense mental activity can trigger cystitis. Another cause is hormonal imbalance in postmenopausal women, which allows bacteria to more easily penetrate the bladder wall. Lastly,
anatomical features, such as when the urethral opening is located too close to the vagina, can cause mechanical transfer of bacteria into the urinary tract during intercourse.
So, contrary to popular belief, cold alone doesn't cause cystitis. It merely creates favorable conditions for bacterial growth. Look here. When the body gets cold, blood flow in the pelvic area slows down, which lowers the body's ability to fight infections. Poor circulation reduces local immunity, and that creates a perfect environment for bacteria to multiply. In 75% of cases, cystitis is caused by E. coli. In other cases, other bacteria or viruses are to blame, like herpes, which many of us carry. It becomes active quickly as soon as we get cold.
Interesting. Why do many people get cold, but not everyone develops cystitis? And even if they do, why do some recover without medications? Because our body produces its own natural antibiotics, cytokines, and antimicrobial peptides. Look, your immune system is like a security team in a store. Cytokines are like alarm systems that go off when health thieves, infections, and bacteria get inside. They sound the alarm and call for security. Your security is the peptides. They catch bacteria or viruses and stop them from attaching to the walls of the bladder. This is that same inflammatory response. And once the health thieves are neutralized, the guards stop the inflammation and restore order, healing the damaged bladder lining. As we age, this security system doesn't work as quickly or efficiently. That's why cystitis has to be treated with antibiotics prescribed by doctors. And let's clarify the situation with antibiotics. The fact is, all doctors, regardless of their specialty, work according to specific protocols. These are standards and guidelines that help doctors make decisions in diagnosing and treating illnesses. When doctors follow protocols, they take certain steps like running tests or prescribing medications to avoid mistakes and improve treatment outcomes. It's like a roadmap or GPS for doctors, guiding you toward recovery. And according to these medical standards, antibiotics are prescribed for cystitis. But is it possible to treat cystitis without them? We don't always immediately use broad-spectrum antibiotics. Sometimes ordinary uroseptics and supplements are enough. They can be used for uncomplicated cystitis. But when it comes to complicated acute cystitis with hemorrhagic symptoms, we are forced to use broad-spectrum antibiotics to protect other organs.
But sometimes antibiotics help only briefly, and then the cystitis comes back. Why don't antibiotics work for cystitis? Does it mean the body has become used to them?
If a patient has taken antibiotics that initially helped but later stopped working, we talk about bacterial resistance to a specific type of antibiotic. Why does this happen? Because patients often fail to complete the prescribed course of antibiotics. As a result, some bacteria survive and acquire the ability to resist that antibiotic in the future. This is how super-resistant bacteria emerge. But there's another reason why antibiotics may not work: counterfeit medications that simply don't have any effect. If you buy the same drug from a different manufacturer, it might actually be effective.
One of our subscribers shared her story of cystitis treatment. She tried every antibiotic, immune modulator, treated her vaginal flora, intestines, did everything imaginable, but every winter she still gets cystitis, and she's not alone. The first reason is chaotic use of antibiotics and lack of government regulation on their sale. Second, improper use of medications prescribed by doctors. A patient starts treatment, sees improvement, and immediately stops taking antibiotics without following the full course. Third, lifestyle, frequent stress. Additionally, comorbidities like gastrointestinal disorders, hormonal imbalance, and diabetes can also lead to cystitis flare-ups. And one more factor that urologists rarely pay attention to: The patient must be examined in a gynecological chair, as anatomical features may contribute to chronic cystitis. There's an interesting opinion that if a doctor diagnoses you with chronic cystitis, it means they haven't found the real cause. Some well-known urologists even claim that chronic cystitis is a non-existent disease. They believe it's just a general term for a number of cystitis conditions, each of which can actually be treated if you find the cause.
This diagnosis does exist in the International Classification of Diseases. It refers to 2 or more episodes of cystitis within 6 months. But your question points to poor quality treatment of cystitis by some doctors. Can I criticize other doctors? There are enough critics already. But what is worth saying is that cystitis is not such a simple condition. It disrupts patients' lives, and the approach to diagnosis and treatment must be thoughtful and comprehensive.
The expert's position is clear. Let's assume that chronic cystitis is a condition where either there's a regular source of bacteria entering the bladder, or there's another issue somewhere else, or both. The cause must be found, and only a doctor can do that. What you can do is protect yourself from cystitis in cold weather. How? Here's how. We learned that in cold Siberia, despite the harsh climate, the rate of cystitis is below the Russian average. That's because local residents are used to the cold. Does this mean we can train our body to resist cystitis by dressing lighter? Should we deliberately wear less warm clothing?
If you're someone who frequently gets colds and recurrent cystitis, then perhaps cold exposure training and a generally healthy lifestyle are what you need. But if you experience only cystitis, it's better to see a urologist, and possibly also a gynecologist, immunologist, and gastroenterologist. When these 4 specialists work together, they can help you get to the root cause of cystitis.
Getting used to cold or doing cold training is possible if you're healthy and want to try. But exposing a weakened body to such stress is dangerous. With cystitis, it's definitely smarter to dress according to the weather. And you know how they easily check whether you're dressed warmly enough to avoid getting cystitis? Here's a simple test to check if you're dressed warmly enough. After a walk, touch your thighs and lower back. If they're cool, it means your clothing isn't adequate. Pay special attention to your lower back. Keeping it warm is one of the main cystitis secrets of Chinese grandmothers, and not just them. In Central Asia, for example, people traditionally wear a wide belt made of camel wool. It retains heat in the lower back area very well. Such a belt is especially helpful during cold desert and mountain nights. Interestingly, cystitis most often begins not from general body hypothermia, but from localized chilling, particularly in the lower back and lower abdomen. If, for instance, only your hands get cold, it's unlikely to trigger cystitis. What matters most for bacterial activation is the cooling of body parts directly connected to the bladder. But even more interesting, overheating can also provoke a cystitis attack, as it creates favorable conditions for bacterial growth, just like cold does. So does that mean you shouldn't go to the sauna if you have cystitis? And what about putting a heating pad on your stomach as suggested online to relieve spasms? Let's clarify these points with our expert.
Warming the abdominal area, including hot baths and saunas, can indeed relieve symptoms. Muscle spasms are reduced, pain goes away, and the frequency of urination decreases. It may seem helpful, but no, because you're not addressing the underlying illness. If someone tries to treat cystitis this way alone, they risk complications. That's why any heat therapy should only be used in combination with the main treatment.
So, remember this, heat does indeed relieve spasms and ease symptoms during cystitis flare-ups, but it's not a cure. That's why going to the sauna is not recommended without a doctor's approval, and taking a hot bath is also discouraged. A heating pad on the stomach is off limits.
But soaking your feet in a basin of warm water, that's allowed. And here are the two main mistakes women make when treating cystitis: using heat and self-medicating with antibiotics. Taking antibiotics without a clear indication at an older age can destroy gut flora and lead to constipation, diarrhea, or other problems. Don't do it.
So, what can you do for cystitis? How do you treat it at home? Doctors say you can and should change your diet. But honestly, I don't quite understand how exactly food affects the inflammatory process. Do you? The ancient Egyptians believed that cystitis was a disease sent by the gods as punishment for poor nutrition. And in ancient Greece, honey was used actively for treatment, considered a divine product. Thanks to archaeologists, we've learned that the ancient Egyptians treated cystitis with a mixture of honey and beer, an unexpected combination. Although, is it really that unexpected? The antibacterial properties of honey are well known and confirmed by modern research, and beer, according to the Egyptians, was considered almost a medicinal drink. But we are not going to recommend this method. Beer is clearly not our approach, especially since we have more modern and effective treatments for cystitis. And here's one of them. Cranberry juice. Crush a quarter cup of cranberries and pour a liter of boiling water over them. Then add 2 tablespoons of honey. Drink 1 glass 3 to 4 times a day for 10 to 14 days. And here's a tip from me. Try adding a bit of mint or lemon balm to the cranberry juice. It improves the taste and may also help relieve spasms during pain. Cranberries contain substances that prevent bacteria from attaching to the walls of the bladder. Now it makes sense why this berry has long been considered healing in Russia and used in many traditional remedies. And in ancient Rus, decoctions of aspen bark were also used to treat cystitis. In fact, modern research has confirmed that aspen bark contains salicin, a natural analog of aspirin with anti-inflammatory properties. I'll share more methods for treating and relieving symptoms soon, but first, let's hear our expert's opinion on folk remedies and supporting the body.
There's probably no area of medicine left that doesn't recommend supplements. We must acknowledge that many medicines originated from what were once supplements. But it's also important to understand that existing supplements won't cure illness. They're only effective as preventative measures. For example, a product containing cranberry juice is a great aid in preventing chronic cystitis.
Can folk remedies be used for cystitis? Which ones would you recommend?
Urologists around the world agree that cranberry juice, due to its proanthocyanidin content, prevents bacteria from attaching to the walls of the urinary tract and multiplying. There are also many remedies with non-specific anti-inflammatory, diuretic, and antiseptic properties. These include bearberry, corn silk, ginger, honey, string bean celandine, lemon balm, and parsley. All of them can be used as part of an integrated approach to cystitis treatment.
Do you agree with our expert? Do herbs help you? Or do you prefer pharmacy medicines? Share your opinion in the comments right now.
And here are the top 3 folk remedies I've found and tested for you. Let's start with juniper. In some regions of Russia, juniper decoctions are traditionally used to treat and prevent cystitis. Juniper has strong antiseptic properties, helps boost immunity, and provides a mild diuretic effect. Juniper should be taken as an infusion, 1 tablespoon, 3 to 4 times a day after meals. The course lasts 1 month. Here's how to prepare it. Take 1 tablespoon of juniper berries and pour 1 glass of boiling water over them in a thermos, or heat it in a water bath for 15 minutes. Then let it steep for 45 minutes and strain. Dilute the finished infusion to a full glass with boiled water. Bearberry infusion works well for cystitis. Bearberry, also known as bear's ear, is a plant that contains a compound called arbutin. When arbutin enters the body,
It turns into a natural antiseptic that helps fight bacteria and inflammation, especially in the urinary tract. This makes bearberry helpful for supporting urinary system health, as it helps clear the body of infections and promotes healing of inflamed mucous membranes. The recipe for the infusion is on the screen. Pour 1 tablespoon with a glass of boiling water and let it steep for 1 hour. Take it for 1 week, 1 tablespoon 5 times a day, or even 7, regardless of meals. And the third of the best remedies is a decoction of birch buds. Birch buds contain betulin, a substance with powerful anti-inflammatory and antibacterial effects. Bacteria won't stand a chance. Here's how to prepare it. Pour 2 tablespoons of dried or fresh buds with 2 glasses of boiling water and let it steep for 2 hours. Drink 1/3 of a glass 3 times a day before meals for at least a week, preferably 10 days. These effective folk remedies can help you cope with cystitis, but don't forget that you may have an individual reaction to any herb or even to food. And if you have chronic conditions, always check with your doctor to make sure the herbs won't interact with your medications or harm you. Another important point: strengthening your pelvic floor muscles can reduce the risk of cystitis by 40%. So to get rid of cystitis once and for all, we recommend not stopping at treatment alone, but also strengthening your bladder. And now I'll teach you a simple exercise to strengthen the bladder, which you can do before bed, lying in bed. So, lie on your back, bend your knees. Take a deep breath, filling your belly. On the exhale, tighten your pelvic floor muscles, as if you're closing the inner gates and trying to stop urination. Do this exercise regularly, and your bladder health will noticeably improve. By the way, this exercise is also recommended by Chinese healers. In fact, Chinese medicine views all diseases as imbalances of energy in the body. Cystitis in particular is linked to an energetic imbalance in the kidneys. That's why many treatment methods focus on strengthening kidney energy. If you're interested in how the Chinese restore energy, write in the comments and we'll talk about it in future videos. And if you're not interested, write anyway. And leave your questions for our new expert.
Murat Shaipov is here to answer your questions about cystitis. If I have cystitis, does my sexual partner need to be tested too?
If you've been with this person before and never had cystitis, and now it occurred once, there's no need to send them to a urologist. If you have a new sexual partner and cystitis flares up after every encounter, they should be sent to a urologist. A third scenario: if you have multiple partners and get cystitis every time, regardless of who you're with, then the issue is likely not their flora, but your anatomical features. You need to visit a urologist and be examined in a gynecological chair.
Interestingly, there are several unusual symptoms with cystitis that are worth paying attention to. For example, if you have lower back pain, this may signal that the infection has spread to the kidneys, and in this case, it is better to immediately consult a doctor. Also, pay attention to the color of the urine. If it has become greenish, this may indicate a bacterial infection, and if there is bloody discharge, this may indicate damage to the walls of the bladder. Often, with cystitis, an unexplained refusal appears, since the infection can cause a systemic reaction of the body, which leads to chronic weakness. And one more thing. If you notice that the smell of urine has become different and rather unpleasant, sour or ammoniacal, this can also be a sign of a bacterial infection. In general, there are many options for how the body gives you a sign that something is wrong with the genitourinary system. Of course, you will not be able to understand them in our half-hour video. Doctors study for years and make mistakes. So I will give you one piece of advice that you should listen to. If the symptoms of suspected cystitis do not go away within 3 to 5 days, or you notice blood in your urine, do not guess. Contact your doctor immediately.
Timely treatment helps prevent serious complications. Of course, you want an experienced doctor, and we wish you to find one. Our expert will help you do that. In our regular segment, Practical Tip, he'll explain what a good urologist should be like. But first, let me ask you something. Does it matter to you whether your doctor is male or female? Let us know in the comments, we're curious.
And now let's hear our expert's opinion on how to find a good doctor. There's a common belief that the higher the doctor's academic degree, the better. But in reality, professors and academicians won't handle routine cases. They'll refer you to junior colleagues. Another myth is that a female doctor better understands cystitis because she may have experienced it herself. Age and years of experience don't always guarantee the best care either. I would say it's better to look for a doctor with energy in their eyes, someone who's passionate about their profession. Ideally, they perform some surgery, but focus mainly on outpatient care. It's also a plus if they work at a private clinic, simply because more time is allotted per patient there. And it's especially helpful if the doctor's resume explicitly states that they specialize in treating complex cases of chronic cystitis.
We wish you to find a good specialist who will discover the cause of your cystitis and prescribe the right treatment. But don't forget, a lot also depends on you. Don't get too cold, strengthen your immune system, and try to lead an active lifestyle, because as scientists say, activity is the foundation of a long and, more importantly, healthy life without disease. Subscribe to our channel, give us a like, and leave your questions for our experts in the comments. That's all for today. We wish you health and longevity.